In cases of major depressive disorder, when a client expresses having no reason to live, the priority nursing action is to assess for a suicide plan and intent. This ensures client safety by identifying any immediate risk of self-harm. When a client with schizophrenia is observed talking to themselves, the best initial action is to ask what they are hearing. This helps determine if the hallucinations involve commands, which is crucial for ensuring safety. In clients withdrawing from alcohol, tachycardia and hallucinations are the most concerning findings. These symptoms may indicate delirium tremens, a life-threatening condition that requires immediate intervention. For a client who is pacing and shouting, the most appropriate nursing intervention is to speak calmly and maintain a safe distance. De-escalation is the first priority to ensure the safety of both the client and staff. When a client with OCD repeatedly checks a door lock, the best nursing response is to help them identify triggers and limit rituals gradually. This approach supports behavioral control without abrupt disruption. If a client with PTSD is unresponsive and staring blankly, the best initial action is to speak in a calm, grounding manner. Grounding helps reconnect the client to the present and is appropriate for dissociation. Self-harming and an intense fear of abandonment suggest borderline personality disorder. This condition is characterized by unstable relationships, impulsivity, and emotional dysregulation. If a client on haloperidol develops muscle stiffness and fever, the nurse should hold the drug and notify the provider. These are signs of neuroleptic malignant syndrome, a medical emergency. An early sign of lithium toxicity is a fine hand tremor. Monitoring for this symptom is crucial as it indicates the need for close observation and potential intervention. Understanding antidepressant therapy involves recognizing that it may take a few weeks to work. This knowledge is essential for setting realistic expectations about treatment effectiveness. When a client expresses feelings of failure, the best response is to explore what makes them feel that way. This therapeutic approach encourages the client to express their feelings and facilitates understanding. Sweating, agitation, and hyperreflexia suggest serotonin syndrome. This condition presents with neuromuscular hyperactivity and mental status changes, requiring prompt attention. For a client with dementia wandering at night, using a bed alarm and low lighting is the best intervention. Safety is the priority, and these measures help prevent injury. For a bipolar client with pressured speech and pacing, redirecting to a quiet environment is the nurse's priority. Reducing stimulation helps manage manic symptoms effectively. Clients on MAOIs should avoid tyramine-rich foods. This is crucial, as MAOIs interact dangerously with tyramine, potentially causing a hypertensive crisis. In anorexia nervosa, bradycardia and hypotension are expected findings. Malnutrition leads to reduced cardiac output and blood pressure, highlighting the need for careful monitoring. When starting clozapine, monitoring the WBC count is essential. Clozapine can cause a granulocytosis, making regular WBC monitoring crucial for client safety. Attending 12-step meetings supports recovery in clients with substance use disorder. Support groups promote long-term sobriety and accountability, aiding in the recovery process. If a client is screaming and hitting the wall, attempt verbal de-escalation first. Always use the least restrictive intervention to promote client dignity and safety. A common side effect of ECT is confusion and short-term memory loss. These transient effects are expected and should be communicated to clients undergoing ECT.